Headaches can make even the simplest tasks feel impossible, severely impacting your day-to-day life. But to treat them effectively, the first thing you need to do is understand what type of headache you're dealing with, so you can address the root cause. Without this understanding, you'll continue to spiral in a cycle of chronic pain and frustration. So in today's video, we're diving into the science behind headaches, exploring why they happen, and most importantly, sharing simple and effective strategies to help you get rid of them for good. Let's start off with tension headaches, the most common type, often referred as stress headaches. These headaches are caused by overworked muscles in the neck and upper back. When you maintain a poor posture, like hunching over a computer for a long period, or engage in activities that place excessive strain on your neck and shoulders, the muscles can become fatigued and even go into spasm. They place increased pressure on surrounding tissues, including ligaments, tendons, and fascia. What makes tension headaches unique is the referred pain phenomenon. In tension headaches, pain is not always felt at the site of the muscle strain, but often radiates to the head. This happens because the sensory nerves that innervate the muscles and tissues of the neck and upper back share overlapping pathways with the nerves that innervate the head. As a result, the brain interprets pain signals from the neck as pain in the head. The pain from a tension headache is typically described as a constant dull ache or a squeezing sensation around the head, often likened to a tight headband. While they usually don't come with nausea or vomiting, like migraines, they can cause sensitivity to light and sound. If left untreated, tension headaches can become more frequent and persistent, significantly affecting the ability to concentrate and carry out everyday activities. Cervicogenic headaches are a bit different from other types of headaches because their root cause is in the neck joints, not the muscles. These headaches are typically linked to irritation in the upper cervical spine, especially around the C1 to C3 levels. When these joints become stiff, misaligned, or degenerated, they can cause irritation in the surrounding tissues and nerves. One of the key structures affected is the greater occipital nerve, which starts in the neck and travels towards the scalp. When this nerve gets compressed or irritated, it sends pain signals to the brain, which interprets them as coming from the head. This is why cervicogenic headaches often cause pain at the back of the head that can radiate forward toward the forehead or temples, and it usually is one-sided. We call this the ram's horn pattern. In terms of triggers, cervicogenic headaches can often be brought on and worsened by specific neck movements or staying in one position for too long. Things like looking down at a phone or working on a computer for an extended period of time can cause the pain to flare up. If these postural habits continue over time, they can contribute to a cycle of tension in the neck, which increases the frequency and intensity of the headaches. Migraines are some of the most complex headaches, involving a combination of changes in the nervous system, blood vessels, and inflammation. The migraine process starts in the brain with unusual electrical activity called cortical spreading depression. This wave of electrical activity spreads across the surface of the brain and briefly disrupts normal brain function. As a result, the brain releases neuropeptides, chemicals that cause blood vessels to widen and trigger inflammation in the meninges, the protective layers surrounding the brain. This dilation increases the pressure in the blood vessels and triggers inflammation in the meninges, which are sensitive to pain. The inflammation and pressure on the blood vessels activate pain receptors in the meninges, leading to headache pain that is typically felt during a migraine. The pain from the migraines is often one-sided, though it can shift from side to side. Along with the headache itself, many people experience other symptoms such as nausea, vomiting, and heightened sensitivity to light, sound, and smells. In some cases, migraines can be preceded by an aura, which can include visual disturbances like flashing lights or zigzag patterns, or sensory changes such as tingling or numbness in the face or hands. There are many potential triggers for migraines. Hormonal changes, particularly in women, are common culprits. Environmental factors like bright lights, loud noises, or strong smells can also set off a migraine. Other triggers include stress, sleep disturbances, and dietary factors, such as excessive caffeine, alcohol, or certain foods that can prompt a migraine attack. Exposure to repeated headaches can lead to a condition called central sensitization, where the nervous system becomes overly sensitive to pain. Essentially, central sensitization acts like a pain amplifier, causing the nervous system to react more intensely to normal sensations, turning them into painful experiences. This heightened sensitivity makes headaches harder to manage and can explain why chronic headaches, such as tension, cervicogenic, and migraine headaches, may stop responding to medications that once provided relief. It also creates a cycle of medication overuse headaches, or rebound headaches. In this cycle, frequent use of pain relief medications can trigger more headaches, worsening the condition and reducing the effectiveness of medication. So to recap, tension headaches are often caused by muscle strain and poor posture, resulting in a dull, constant band-like pain around the head. Cervicogenic headaches, on the other hand, originate in the neck joints and can cause a one-sided pain that radiates from the base of the skull up the head in a ram's horn pattern. Migraines are more complex, involving neurologic and vascular changes, and are frequently accompanied by symptoms such as visual auras, nausea, and light sensitivity. Now that we have a good understanding of these headaches, let's now talk about how to control them. Join me in this next video as we dive deep into evidence-based strategies for cervicogenic and tension type headaches.